Hello, everyone, and welcome to the World Citizen Artists podcast. Today, I'm very happy to be joined by Suman Thapa, who runs a community healthcare service in Nepal and is a doctor. My name is Willem. I'm from World Citizen Artists, and I'll be the host today. And I'm also joined by Clive Donnelly, who is a climate activist and will also be co-hosting this episode of the podcast. So, thank you all for joining today. And Suman, I was wondering, could you talk a little bit about the healthcare service that you set up, the organisation? What were the kind of problems facing Nepali healthcare, and why did you decide to set it up in the first place?
Hi, William. It's a great honor to be here in this podcast. It was after the 2015 earthquake that hit Nepal that like-minded friends and me, we got together to provide medical services in areas devastated by the earthquake. And it was a voluntary group run by physicians and like-minded people. And we went to these areas that was devastated by the earthquake to provide very comprehensive healthcare, which means all kinds of services like eye services and radiology and gynecology and pathology. So after a period of 1 year, we decided to register the organization because it had done a lot of good work, and also we were raising funds locally, and we had become friends. And so we registered the organization, and we decided to do more comprehensive services in remote areas of Nepal, extreme remote areas like the mountain areas where there are no roads, and sometimes we have to trek to reach there, or even if there are roads, they're not literally roads, they're just something dug off the ground. And so we started providing two large comprehensive health clinics in a year. But to stabilize, but to start something in Kathmandu, which is an urban city, but also to address the needs of the urban people who are poor and are unable to afford treatment, we decided to establish a community health clinic in Kathmandu city itself to break barriers between patients who are unable to afford treatment, for them to come and visit doctors at a community health center where they don't have to pay much money, and also the barrier is broken of meeting a very well qualified doctor.
No, thanks, Suman. And I know you've also talked about the problems of, or some of the dilemmas associated with foreign aid investment in relation to healthcare services. And I know Ek Paila, the community healthcare service you're talking about, was almost a grassroots response to that. I was wondering if you could touch upon that as well.
Because as we know that healthcare and education are the basic needs for any growing individual or any aging person. And just recently, our country has been able to provide insurance to the larger people here. However, these insurances provide only to the government hospitals, and the government hospitals are well equipped by good doctors, but again, there is a long waiting period, etc. So in order to break all these barriers, what we thought was the best is that if we are able to raise funds locally, we will be able to do something from a more private sector that is locally driven. Because I have also spent all my life working in a not-for-profit organization as an ophthalmologist, but we also depend on foreign aid. And post-COVID, we had a crisis where foreign aid, the donor money, it trickled down, and we were not able to conduct many of our activities because it was so much dependent on that. But we know that today, that if we start now, if Ek Paila starts now by trying to get the larger people in Nepal involved in their donations, in if there is a health charity that they would like to give to, if we are able to promote that, and we being transparent, we know that we can overcome those obstacles of depending on foreign aid. So most of our activities are now locally driven through local donations. And also we are collaborating with the local government so that we are able to have a long-term sustenance.
That's great. I think that's a really sort of, well, not just in Nepal, but I think globally speaking, the sort of dilemmas associated with foreign aid and perhaps some of the challenges that may put on local infrastructure. Yes, on the one hand, it's beneficial, but also the need to develop sort of more sustainable, grassroots, locally driven infrastructure. And well, actually, I know Clive wanted to come on this, but almost what are the more on the ground challenges you see with your healthcare service? I mean, I'll let Clive come in on this one. Or Clive, just unmute there. Sorry, Clive.
Oh, yes. So we would love to hear from you on how you deal with the complex humanitarian assistance in relation to health services that you've been offering, and how does you facilitate the instances of emotional distress when you do the assistance?
Pardon me, can you repeat the question again? Because I didn't hear it so well.
Okay, sorry. I'm saying, how do you deal with the complex humanitarian assistance in relation to health services?
The complex
humanitarian assistance.
Humanitarian assistance.
Yes, in relation to the health services, and how does you facilitate instances of emotional distress when you're dealing with individuals?
The emotional distress and the humanitarian, is that the question?
Yes, yes.
All right. Now, I think that providing a humanitarian care has to come very from within oneself. And in today's world, when we think about doctors, we take a bit too much credit for things that we are supposed to do, we have to do. For example, if there is a carpenter and you need to make a table, for a doctor, it's as simple as that. If there's somebody sick, you need to take care of them. And we are already thinking that the kind of work we do is humanitarian. But we have to come out of our comfort zone to do that, to walk that extra mile to do that humanitarian service. And when we talk about really true humanitarian service, it has to be voluntary. It has to be non-driven by any kind of incentive, right? And our experience is that you just need somebody to show the path. And if people believe in you, people start joining the bandwagon and start, coming to achieve what one person or a group of people they envision. So with our organization, we have now seen that people are voluntarily coming even to provide their time out of their private offices because they want to be a part of a good organization. So from the humanitarian aspect, I think that the humanitarian aspect has to be nurtured. I think everybody has got the goodness in them. And if we can nurture that, that would be great. Now, treating with emotional distress of patients, if that is what you are asking, is that it's there are certain things that we cannot cure. For example, no matter how much money one would like to spend on treating a disease, unfortunately sometimes the disease takes over. But then being able to counsel them and show compassion and show a little bit of the human kindness, I think that is a part of medicine that a lot of us have forgotten, is that not everything cannot be cured, but apart from that, there is support. Just instead of just medical support, there is that human kindness and compassionate support that actually is most needed.
Thanks, Suman. And I was wondering whether you think we can see a sort of sea change in attitude of if there's almost a turning point around the corner of attitudes around what it means to be a doctor, what it means to be a healthcare provider across the world. Do you think that's something that's a realistic prospect?
Yes, I think that it's very important that I mean these lessons are for everyone living all over the world, no matter from whatever economic backgrounds we come from. Is that there are countries where the healthcare systems are excellent, but then you can always come out of that and serve other countries where you can help, so that humanitarian effect can go just beyond just the economic comforts or the discomforts that we have.
And something that I did notice you've talked about in the past about the process of funding Ek Paila, the healthcare organisation, was your use of music, performing live music as a way. I was wondering, we've got a lot of artists obviously in the community, a lot of musicians. I was wondering if you could talk a little bit about that and that experience.
Yeah. I tell myself and a lot of people, my friends, that it's actually by default that I became a doctor. And I was born a musician, but and I never got the opportunity to study music. I would have, if I was studying in Europe or in the West or anywhere else where there were music schools, I would probably be a musician today. I mean, educated musician today. I don't know how to read and write music at all, but it's ingrained in me. So it has helped me become who I am. And all my life, I had complexes of identifying myself as a musician who people would like to hear, or a doctor who people like to believe that, because I had. But now, in my middle age, I have been able to bring my two careers together, and I am at peace because I play music to just to be happy, and also with great musicians to help with musicians, so that other people can appreciate the quality of music. But at the same time, the music raises funds for Ek Paila. So because now what happens is that when there is a doctor who plays music and who's also running a health outfit that has a social initiative to help the larger good of people. So it's people want to believe in that, because they say, okay, like it's not just a music band who's doing this, but there's also a doctor who's actually running another organization. So in that way, a lot of the money that we raise is through music. I won't say a lot of the money, because but all the awareness that we bring about through music, and that lets people know that there is an organization such as Ek Paila, and then they come forward as patients, and then they also donate money. So it does both the work. It's helping me treat patients, and it's also helping me play music.
No, I mean that's really interesting. I think, well, me especially, and certainly I'm sure people watching are innately curious about the link between art and creating some sort of social change. So it's really, well, like I said, interesting to see how you've managed to put that into action. And is the kind of project that you've been working on with Ek Paila, is that something that other people have replicated? Is that something that's sort of broadened out in Nepal in these diverse sort of styles of healthcare provision, or are you firmly sort of the only one providing this kind of service still?
We are the only one who are providing this voluntary services in remote areas of Nepal, because there are groups that go and provide services, but it's out of their work. So they are all being paid for their time off from work. So it's part of their job. But over here, it's complete volunteerism. So So the beauty of it is that we are being able to also influence our younger generation, and they want to be part of Ek Paila. So we take young volunteers so that tomorrow they feel that tomorrow we hope that in whatever field they are, they understand that volunteering and doing some good work is so important. But so far, nobody has replicated this because it's hard for the Nepalese people also it's not easy for a lot of people to just drop everything and volunteer, because many of the people have their economic challenges coming from a developing country like Nepal. But the people who do it are a group of people who have economic challenges, as well as people who are quite stable in their every day-to-day life. But it's just that one needs to have the heart to do it. So it's getting there, and we hope that this will be replicated in the future. But for long-term sustainability, we are working with the government, because volunteerism can only be for a while, but we need for long term, for anything to continue as on a long term basis, we need to set systems, and we need to have people employed with salary, so that the job is done. So in that way, the Ek Paila initiation is by a group of volunteers, but hopefully as we get down the line, we will have a system where it will work through regular salaries, etc. But the entire goal will be to provide affordable treatment, to keep doors open for volunteerism. Yeah.
So, almost as an even longer term strategy, what specifically are the kind of interventions you would like to see from the government, and maybe not just in Nepal, but maybe in other countries more generally, to build this kind of sustainable healthcare system that's resilient and can respond to people's needs, not just in urban centres, but across different regions?
So first of all, the problem that we have whenever we talk about the government in the developing countries or underdeveloped countries, is that the doctors don't want to go for a government job because the salaries aren't good enough to meet, to make you meet ends. So the government really has to be able to, be able to pay their employees an amount that is justifiable for them for any employee to be able to look after their health, to put their children in schools, to be able to save a little bit of money. So that is one of the challenges. The second challenge is the facilities that the government that they make, because sometimes the infrastructure of care is very poor in government built places. So they really need to invest on the infrastructure. And thirdly is that they need to have people running these the health facilities by people who have experience in health, experience in economics, and experience in management, etc. Because most of the politicians that are seen in underdeveloped countries are actually, they have a very minimal amount of education and experience on the kind of work that they're doing. Now, I don't get me wrong. I wouldn't say that people who are not educated are not wise, but a certain amount of experience in the field is absolutely necessary when we are talking about health, because we need to understand that what are the basic healthcare that needs to be provided by a certain amount of by a hospital, and that has to be absolutely free for children coming to get immunizations, for emergency treatments, which now the government has been able to provide. But the continuation by providing the right amount of budget to run a hospital, So in this way, we have grown up. Always seeing failures in the government. For example, the government is not led by one political system for a while. I mean, after 3 years, then there's a change in the complete leadership, and then what was planned again has to be repeatedly taught again to the new leaders, and then the time is lost, and then again so that's one thing. Then the facts about corruption. I mean, there has to be complete transparency. Some of the leaders, some of the people in the position, they just want to be there just to earn money. And again, then where does corruption lead? So that entire system needs to be taken care of. So what we have done, we've also been able to put our hands a little bit on this, is that Ek Paila is now has already tied hands with the government to run a 15-bed primary care hospital in one of the villages in Nepal. And what we did, what we asked the government was that we asked the government, and we said that, look, you can have us as a partner where we will choose the doctors for you, and we will provide you monitoring in terms of the medical facilities that you have built, in terms of what needs to be done. And while the government provides us with the budget to run the hospital and the infrastructure, and at the same time, we've also had private organizations in corporate houses in Kathmandu, where we went and approached them and said, okay, can you give us some extra funds? Like, let's go into a public-private partnership where the government is involved, a medical outfit like Ek Paila is involved, and then the private sector also injects some money into that system. So in that way, financially, it'll be well endowed to be able to give all the salaries of all the employees. At the same time, the extra that comes from the government, and the extra money that comes from the private organizations, what they will do is that we can have extended programs out of our 15-bed hospitals, like, for example, community programs and also research that we can do. And then Ek Paila, which is a team of specialized doctors, like, for example, I'm an eye surgeon, and I would go there once every 2 months and provide specialized eye care. And similarly, then after, on rotational basis, there would be a dermatologist who would go and provide. And these primary primary care hospitals, they are just run by general physicians, and they don't have specialized services. But when we go and provide them, then even these primary hospitals will have specialized doctors visiting them. So this will add value, and this will make sense. And ultimately, we will teach the people in the government. The ownership will be of the government, and we will teach people in the government authorities as to how to run a hospital. And we have taken a contract of 10 years, and we hopefully by 10 years, our aim will be to slowly withdraw, like foreign aid people do withdraw from countries, to slowly withdraw from that system, so that the government is able to continue doing that. Because we blame the government, but at times we have never also the experienced people in management, doctors, etc. We also haven't really sat down with the government and really on the field and taught them how it can be done from a different outlook. Although they are government employed doctors who are doing this, they have been doing this as a homework. But then somebody from outside the main system can give another view. So we are very hopeful that this new system, this new collaboration, is going to be a novel way of running a 15-bed hospital, providing primary care, as well as specialized care at regular intervals.
And well, sort of on that note, with the sort of setup of the healthcare system you're talking about. Again, I think Clive would also want to comment on this, was how Nepal and the Nepali healthcare system experienced COVID-19. Again, Clive, I'll let you jump in on this one.
Yes, sure. On that same basis, on how the government is working on review, I would love to ask how does, with the nature of vulnerability when disasters strike, generally, are there any proactive government efforts towards advancement of early warning mechanism to prevent human suffering in terms of disasters? For example, the instance of COVID, we saw there was a lot of overwhelming situation in hospitals globally. And so, in instances of that, more when perhaps of a disaster, do we have early warning mechanisms that are proactive rather than being reactive?
Well, it's very complex. For example, when we had the mega earthquake in 2015 and it destroyed many parts of Nepal, the government response was extremely slow, and the government wasn't prepared for it. And this was the truth. But however, I mean, the immediate life-saving procedures were done because there were doctors and paramedics from the government, from the army, from the police, and which belong to the government, and also from the private sector that actually helped that actually saved lives. But after that, the immediate response, then, like building of homes for the people whose homes there were no homes. So that was really slow. So we still had people living in shelters for almost about 1.5 years post the earthquake, because there was so much money that came in, through foreign aid, but there was no proper roadmap for how to build houses or how to disperse that money, and which took a really long time. But now I guess that we hope that never happens. But if we are to have another crisis, that there will be mechanisms on how to deal with that. But now the government has planned some stereotype houses, as this is the earthquake-proof houses. This is what we have to do. So the process has been slow, but we have got there. Now, regarding the COVID, again, with the COVID, we have an open border with India, and the COVID, the number of patients with COVID increase after there is migration, because India and Nepal's southern border is an open border with India. So as soon as the number of patients with COVID increased in India, we had a whole influx of the migrant workers who were working in India. They came to Nepal, and because it's a really long border, is that it's very hard to stop people from entering from anywhere. So that was a big problem. There were certain checkpoints where they kept isolation centers. They did testing, but there are many loopholes through which people can come. And when that happened, and the number of cases of COVID increased, then Kathmandu being the center where all the facilities are, it was very well taken care of, because there are ICUs and well-equipped hospitals and doctors. But again, the problem started to hit the people living in the rural areas, because they didn't have anywhere to go. And even the number of people who died, I don't think all the deaths were accounted for, because people died and they were not tested for COVID, which is very unfortunate. And so what some of us did, and what Ek Paila again stepped into, was that when we had the second lockdown, there were people with COVID isolated in the villages, and they were asking for medication, packages of medication, to the central government, and the central government was overloaded with with the amount of demands. And by the time they were able to reach people in the villages, it was becoming very late. So we stepped in and we said, okay, because we had already provided healthcare to these remote areas. So we went back to our grassroots people who were working in these areas, and we said that, okay, would you like some medicine packages? And then they said, yes, can you send? But we said, we want some genuine, we want some genuine numbers as to how many people have COVID. So the local government, they sent Ek Paila, which is a not-for-profit, non-government organization. They sent us request letters. So instead of sending it to the central government, they were sending it to us. So which was it was nothing for us to be proud of, but we were able to provide to almost I think about, say, 30,000 people. We were able to send out packages into more than 50% of our country area. So that was a very impactful work that we did. And through social media, we were posting this, our activities, and the Nepalese people, they were donating directly to us. They were donating their money directly to us. They were providing us money, and it was through their money that we were able to purchase the medicines. So and of course, I mean, ultimately, we were not able to provide to all the places, but at least we did come up some help even during the COVID time. So we have to join hands. I mean, the government is the most powerful working body, and if we, from the private sector, from the not-for-profit sector, and if we are all able to work together in partnership, then only we can overcome these challenges, because the government needs help, and at the same time, the government can't be blamed, because a lot of the people there really do not know how to do things, and if they are people outside the government who know how to do it, they should be able to show them the way.
Yeah. No, thanks very much, Suman. I was wondering, almost on that note, what sort of briefly, just before we finish, your sort of broader messages to people who perhaps are living in a country that faces certain developmental issues, such as healthcare issues. What are the kind of steps that they can be taking to initiate some sort of change? Like obviously you've done with your with Ek Paila in rural Nepal.
What I really feel is that foreign aid is extremely important, and because it helps you start up and then continue to do good work. But at the same time, the foreign aid will ultimately trickle down, and the foreign aid is also not there for forever. So we have to find innovative ways on how we can implement the healthcare system, and especially in countries with low resources in infrastructure and low human trained resources. We have to do a lot of opportunistic screenings and opportunistic plans, because we cannot treat everyone. But what is the major disabling problem in our system? For example, child mortality, for example, pregnancy-related deaths, accidents. So we need to identify them and address them immediately, and helping one another, despite from whatever economic backgrounds that we come from the human compassion, and that we share, and learning from systems that have worked in other countries, and not trying to reinvent the wheel by doing things that will cost more money. I think that's the way to go ahead.
Great. I think that's a really fantastic note to end things off. So I would just like to say a big thank you, Suman, for joining, and for people watching. Do check out Ek Paila, their website, and you can read a little bit more about what we're doing. And you feel free to join us at worldcitizenartists.org. Check out our website again. But yes, once again, thank you, Suman. It's been great speaking to you, and I hope everyone who's listened or watched this has enjoyed it too. So thank you.
Thanks, William. Thanks, Clive. It's been a great pleasure to be here.